Okay, let's look at another distinction that is often drawn in medical decisions about life and death. It's the distinction between acts and omissions. And it's sometimes put in these terms. Thou shalt not kill, but needs not strive officiously to keep alive. And as I've indicated here, doctors use this expression as a way of saying, I don't have to try to keep my patients alive. For example, let's say maybe I have an elderly patient in an advanced state of Alzheimer's. It would be wrong for me to give that patient a lethal injection, but if the patient gets pneumonia, I don't have to give the patient antibiotics, even though I know the antibiotics would simply and cheaply and effectively clear up the pneumonia and allow that patient to live. But while thou shalt not kill, as the saying goes, you don't have to strive to keep alive. Now, it's interesting that article by a doctor in a very respected medical journal, The Lancet, quotes this as an old dictum we were taught as medical students. But in fact, it's not really an old dictum. It's lines from a poem written in the 19th century by Arthur Clough, and the poem is satirical in intent. So it is not endorsing these lines as wisdom. It's actually ridiculing the way in which, although we say we should not kill, we don't help to keep people alive. And the ridicule is very clear when you look at other lines of that poem. For example, it says, it says that thou shalt not worship any other god except for the currency. So it's satirizing the attitude of worship of money, for instance. So it's certainly not it's certainly not in its origins a matter of wisdom, although that is sometimes the way it's invoked. Now, here's a case in which that distinction was relevant, that raises this kind of issue. This is another very famous case in bioethics, the case of Baby Doe. Doe, of course, here is a legal pseudonym. Case that occurred in Bloomington, Indiana, with a baby born with Down syndrome, one of the more common birth abnormalities, although it is becoming less common now because it's detected during pregnancy, and about 90% of the women who are told that they're carrying a fetus with Down syndrome terminate the pregnancy. But it certainly was more common. So this baby was born not only with Down syndrome, but with a blockage of the digestive tract. That's more common in babies with Down syndrome, but it's actually independent of it. Now, the blockage of the digestive tract means that the baby would not be able to digest food. So you could put food in the baby's mouth, but it would not get through to the stomach, and the baby therefore would not be nourished and would die from lack of food. But it is operable. You can operate on that blockage and remove it with a very high chance of a successful outcome that will enable the baby to eat. So normally, if the baby did not have Down syndrome, there would be no question that would be what you would do. And I think there's no doubt that the parents of Baby Doe would have done that if the baby had not had Down syndrome. But because the baby did have Down syndrome, and because they did not wish to bring up a child with Down syndrome, they refused consent to surgery to remove the blockage. So this is a case where they would not have had any legal hope of saying, we don't want a baby with Down syndrome, please give the baby a lethal injection. That, of course, would simply have been homicide, murder. But because the baby had this blockage, they were able to say, we refuse consent to the operation. So they were bringing about death by an omission rather than by an explicit act. And in fact, they were successful in achieving that end, in that the Supreme Court of Indiana said they had the right to refuse consent to surgery to remove the blockage. This was during the presidency of Ronald Reagan, who of course was supported by conservative groups, Christian groups, who were appalled at the decision of the Supreme Court of Indiana and attempted to mount an appeal to the United States Supreme Court. But before the Supreme Court could hear the case, Baby Doe died. So the case was never heard by the Supreme Court because it became moot. But there was a vigorous public reaction to that, and President Reagan tried to bring in guidelines to say that hospitals receiving federal funds could not treat babies with disabilities differently from the way they treat babies without disabilities. And then the American Association of Pediatrics objected to this because it said the government is interfering between the doctor and the patient, and you can't just try to deal with the vast complexity of different cases with such a simple ruling. So it went through more court decisions, and eventually a considerably watered down version of the rule was brought in. But the question to think about here is, again, is this a sound distinction? Is there really any moral difference between saying, I'm going to refuse consent for surgery, knowing that that will mean that the baby will die, and saying, I'm going to give the baby a lethal injection, knowing that it will die? I would suggest that, whether or not you think the parents were justified in this case, whether or not you think it's wrong to end the life of a child with Down syndrome, a newborn with Down syndrome, you can still think about whether there's a difference between the two ways of doing it or not. And I think you could think that it's wrong to end the life of a child with Down syndrome either by an overt act like a lethal injection or by an omission like omitting to permit surgery, or you could think that they're both justifiable. But it seems to me hard to say that one is justifiable, the omission, bringing about death by omission, and not bringing about death by the explicit action. Okay, I want also to talk briefly about anencephaly. This is perhaps the most severe birth abnormality that exists. Here's a diagram showing a normal infant and one with anencephaly, and you can see that essentially the whole of the brain except for the brain stem is missing. So these babies are not brain dead again because they have a brain stem, they have some brain function, but all of the parts of the brain associated with consciousness are not there, simply not there. So there can never be any consciousness, any recognition. The child will never be able to recognize his or her mother, let alone talk or do any of the other things that are involved in normal human life. Here's a baby born with that condition. Her parents, actually, it's an unusual case because the anencephaly was detected during pregnancy, and almost all parents told that their child will have anencephaly would end the pregnancy. But these parents didn't. As they say, we knew there was a life in there, and we knew that we should give her every chance to live. So they didn't terminate the pregnancy, and she was born. But note that after she was born, they signed a do not resuscitate order, but requested that she be kept comfortable and fed. And the question is, how can you do that when you're saying here, we should give her every chance to live? If you really want to give somebody every chance to live, if you really think that their life is, as John Paul II said, of equal value with every other life, then why not resuscitate them if they need resuscitation, so that they can live as long as possible? And although babies with anencephaly usually do die within a few days after birth, that's precisely because they are not treated. And in the rare cases where parents have insisted on treatment, they certainly live much longer than that. They can live weeks, months, perhaps even a year or two. So if all human life is valuable, you would think those weeks, months, or a year or so are also valuable. But in fact, as the parents say, they did not resuscitate, and so she died over a few hours, which may well have been the best thing. There's no point, I think, in caring for a child with such a severe disability. But again, I don't think it's compatible with the idea that all human life is of equal value. So, is it different from the Baby Doe case? Well, different because the disability was more severe, but I'd suggest it's not compatible with this principle that as far as the right to life is concerned, every innocent human being is absolutely equal to all others.